Dr. Purvez Grant, a renowned cardiologist, the mainstay of Ruby Hall Clinic. He is known, of course, for his commitment as the managing trustee. It is our pleasure to call upon him to address his team and other well-wishers.
Good evening, ladies and gentlemen, friends, colleagues. Mr. Rahul Bajaj, Chairman of Ruby Hall Clinic, Dr. Farooq Udwadia, Mrs. Farooq Udwadia, Mr. Bhatt, Prachi Sate, the directors of Ruby Hall, ladies and gentlemen, and all doctors that have come here today. It is indeed a great honor today to be here when the ICU has completed 25 years. It's a phenomenal achievement, and a lot of hard work has gone into achieving this. I remember I came back from England nearly 30 years ago. At that time, Ruby Hall Clinic was a tiny hospital, doing reasonably well, but we took a decision that the hospital had to grow. 1 year later, Prachi Sate, my friend, colleague, landed up at Ruby Hall. When I was in England, I had a friend called Dr. Hopkinson. He was in charge of the ICU at a hospital called East Birmingham Hospital. At the East Birmingham Hospital, Hopkinson and I became very close friends. And one day he rang me and he said, if you've got any blue-eyed girl who we can teach and somebody who's really pushing and wants to do ICU, I will take her for 3 months. Prachi Sate was invited by me to go to England. She went to England, not for 3 months, 6 months, 9 months, 1 year, and came back after 1.5 years. Even her husband got worried whether she's coming back. Anyway, Prachi came back, and then from a very small beginning, the ICU at Ruby Hall was started. And today, I think it is the largest ICU in India with nearly 160 beds. A great achievement. It's probably got more modern equipment than most ICUs in India today. And I think it's thanks to our donors, our friends, who have helped build up this ICU. Today, Ruby Hall Clinic is one of the largest cardiac centers in India, and we do something in the range of 35 angios every day and plasties. We are also one of the largest cancer centers in the country. And recently, I must say, as far as transplantation is concerned, Ruby Hall has been given the honor of being, by the government of India, as being the best hospital for transplantation in the whole of India. We excel in liver, we excel in kidney, we excel in bone marrow, and our new feature is heart transplant. We have now completed 5 heart transplants. In fact, day before yesterday, we did 1 heart transplant. That was the 4th. And the day before that, we have done total 5 heart transplants. In the last 2 days, we have done 2 heart transplants. And it's not an easy achievement doing heart transplants, but I think now the system is in place. And I'm sure that the heart transplant will do extremely well. The other important thing is that the results of heart transplant are fantastic. And all our patients have been doing well so far. We also are known for our charity, and I must say that every month we do 1.4 lakh free patients. Oh, no, I'm sorry, it's 1.4 crores free patients, and that comes to nearly 14 to 15 crores every year. So Ruby Hall is the hospital that does the maximum amount of charity in the whole of Pune, and I think in the whole of Maharashtra as well. I'll just take you to what is the future of Ruby Hall. You've all seen the new hospital that has come up in Vanauri. The Vanauri hospital is doing extremely well, and it's 120 beds. In addition, the Hinjewadi Hospital has started 2 months ago, and I'm very pleased to say already 15 patients have been admitted at Hinjewadi, and today they did 60 patient health checkups. So I think the Hinjewadi has also now being put on its place. We must also mention that we have 17 medical centers at various companies like Volkswagen, etc., all over Pune. And we have 18 diagnostic centers all over Maharashtra, all equipped with MR and CT scans. In fact, the Ruby Hall Group is the largest single owner of MRI and CT scans in the whole of India, a proud achievement. We've also got a nursing college, which is running extremely well, and thanks to the matron and nursing college staff. And there is another building coming up in Vanauri, which will be the new nursing home, where we'll be able to house about 140, 150 nurses. Next slide, please. This is the present Ruby Hall that you're seeing here today. And that's where the main Bajaj building is. We're very lucky. Rahul Bajaj, my close friend, has donated very, very freely to Ruby Hall. And I must announce that this particular year, he has given us more than 12 crores. It's not a small amount. Thank you, Rahul. Next slide, please. Now, what are we going to do in Ruby Hall? This is the present structure of Ruby Hall. You got a pointer here, anyone? Okay, this is the present, no, the point, not working? Oh, okay. You can't see it on the, anyway, this is the present building of Ruby Hall. We go on to the next slide. And this is what's going to happen shortly. So what's going to happen, we will first start developing a little bunker here. It will be a bunker here where the new linear accelerator will come. Above this there will be 3 stories. Then in the main Bajaj building that you see over here, we're going to start going upwards and 4 stories will come up here. So 4 stories more will come up. 4 stories more will come up in the main Bajaj building that is going up there. Next slide. That's the building that's going up. Next slide. And next slide. Achha. Now this is what Ruby Hall is going to look like. You'll get the main building. I'm sorry, the pointer is not showing because it's quite this thing there. So on the main building, you will get 4 stories. You'll get a second tower coming up here, and you'll get another tower coming up here, and another car park that will be coming up here. And this is the master plan of Ruby Hall that we expect to be completed in the next 2 to 3 years. Next slide, please. And this is what the building is going to look like. It's a really flashy, beautiful building. Next slide. And this is the artist's impression of what you'll see Ruby Hall very shortly in the next 2 to 3 years. Next slide. And this is our Vanauri Hospital. Next slide. That's the new nurses' home that's coming up next to the Vanauri building. The building has already come up to the 10th floor. Next slide. That's our Hinjewadi Hospital, brand new hospital, which is just launched 2 months ago. Next slide. And what is the new future things that are coming in Ruby Hall? First of all, I must inform you that very shortly, robotic surgery will start at Ruby Hall. And this is a machine that is very good to treat prostate cancer, gynec problems, colorectal surgeries. And I must thank Rahul Bajaj and his family for donating for this particular machine. The machine will be one of the few machines in Maharashtra, and I think Maharashtra has got only 4 machines in Bombay, so we'll possibly be the 5th machine in Maharashtra state. Next slide. This variant linear accelerator has also been ordered and will arrive in Ruby Hall in the next 2 months. It's a very expensive machine, but it will put Ruby Hall again in the future map of India as far as cancer is concerned. We've also put a 3D tomography machine, which is supposed to start this month. Next slide. This is a new PET scanner that is also coming to Ruby Hall Clinic. It will be the state-of-the-art PET scanner. Next. Virtual clinic, Mr. Bhote will talk a little bit about it, so I won't go too much into it. But with this clinic, we can join all our units together and we can actually see what is going on in all the units everywhere, including the heart sound of a patient sitting in Baramati. You can put him in the virtual clinic and listen to the heart sound. But Bhote was going to tell you a little bit more, so I won't go into that. Next slide. Impala Device. This is a new device used in patients with heart failure, and we are very seriously looking at buying this device. It has one catheter in the left ventricle and one in the aorta, so you can keep patients alive before they go for heart transplantation. So this is a new technology that is available. Only the problem is the catheter is very expensive. It's a one-use catheter, and each catheter costs 20 lakhs. They don't allow you to reuse it, but being in India, we'll always find a way. Next slide. This is the proposed expenditure over a period of next 3 to 4 years. We are planning to put in nearly 200 crores into the main hospital. And with this proposed expansion, I am sure Ruby Hall today, which is one of the best institutions in India, will continue to grow so. Next slide. I was always wondering and asking Prachi Sate, I said, why is your ICU always full? And the reason is, I never saw such concern. Every doctor in the hospital has come to see me. So this poor girl, every doctor wants to visit the poor girl in the hospital. That's why this ICU is so popular. Thank you very much. I won't say too much. All the very best, Prachi. And I'm very happy what you have achieved. And may you continue to achieve further credits. All the very best. Thank you.